Superficial muscular anatomy of the medial side of the knee can be easily appreciated in this artist's rendition. Anteriorly, note the vastus medialis running to its insertion onto the medial retinaculum and quadriceps tendon. Posteriorly, the medial head of the gastroc can be seen as it arises off the posterior femur. Situated between these two muscles are some of the key muscular tendinous structures of the medial knee, namely the sartorius, the gracilis, semitendinosus, and semimembranosus. Also shown here are the superficial neurovascular structures of the medial knee, which are the greater saphenous vein, the saphenous nerve, which is protected during hamstring harvest, and the infrapatellar branch of the saphenous nerve, which can be a site of a painful neuroma if damaged during medial portal placement during knee arthroscopy. In general, the anatomy of the medial knee is referred to as being divided into three layers. Layer 1, most superficial, being the sartorius and the superficial investing fascia. Layer 2, consisting of structures within the plane of the superficial MCL, including the medial patellofemoral ligament. And the deepest layer, layer 3, represents capsular structures which thicken beneath the superficial MCL to form the deep MCL. Posteromedially, layers 2 and 3 coalesce to form the posteromedial corner, which is reinforced by the 5 insertions of the semimembranosus. As we now move to our cadaveric dissection, we will explore these layers moving from superficial to deep. For orientation purposes, all dissection will be conducted on a left knee specimen. Here we can see the structures of layer 1, the sartorius muscle with its broad tendinous insertion, and the superficial investing fascia. Note the close proximity of the saphenous vein, saphenous nerve, and its sartorial branch as they course just posterior to the sartorius and anterior to the gracilis and semitendinosus. These sensory nerves may be injured during hamstring harvest for ACL reconstruction, resulting in numbness along the medial leg. It is for this reason that great care is taken during hamstring harvest to protect these branches. Reflecting layer 1 reveals the gracilis and semitendinosus tendons which lie between layers 1 and 2. These tendons traverse the medial knee to insert on the proximal medial tibia at the pes anserine, approximately 3 finger breadths distal to the medial joint line. Just deep to these tendons lies layer 2, which is made up of structures on the plane of the superficial MCL. The MCL arises from the sulcus on the medial epicondyle of the femur, just distal and anterior to the adductor tubercle. The superficial MCL then inserts approximately 4.5 centimeters distal to the joint line, just deep to the pes tendons. It serves as the primary restraint to valgus stress and is a secondary restraint to tibial external rotation and anterior translation. The superficial MCL is made of 2 distinct bands. The anterior portion consists of vertically oriented fibers, while the posterior oblique fibers blend with layer 3 posteriorly to form the posteromedial joint capsule. Anteriorly, layer 2 consists of the medial patellofemoral ligament, running from the medial epicondyle to the medial aspect of the patella. The medial patellofemoral ligament limits lateral patellar excursion and is commonly injured with patellar dislocations. Before proceeding to layer 3 and the posteromedial structures, let us take time to demonstrate the technique of hamstring harvest as is commonly used for ACL reconstruction. Remember, the hamstring tendons are located between layers 1 and 2. After splitting the sartorial fascia, the gracilis, located proximally, and the semitendinosus, located distally, are identified. Intraoperatively, a careful dissection is carried out proximally to protect the saphenous nerve and its sartorial branch. After dissecting the tendon off its insertion at the pes, a whip stitch is placed in the tendon and it is harvested with a tendon stripper. On average, 20 to 25 centimeters of tendon can be reliably obtained in this manner. The process is then repeated for the semitendinosus. Note the distal insertion of superficial MCL fibers just deep to the pes tendons. Now let us continue our dissection by reflecting the anterior parallel fibers of the superficial MCL, thereby revealing layer 3, made up of capsular tissue and the deep MCL. Note posteriorly, the posterior oblique portion of the superficial MCL joins the capsule and semimembranosus to form the posterior medial corner. The semimembranosus reinforces this posterior medial corner with its 5 insertion sites. There are 2 tibial insertions, a direct insertion on the posterior medial corner of the tibia, and a second tibial insertion just deep to the superficial MCL. The semimembranosus also has 3 soft tissue insertions, the first blending with posterior oblique fibers of the MCL, a second doubling back to insert proximally on the joint capsule over the medial meniscus, and the 5th and final insertion runs proximally and laterally across the posterior capsule to form the oblique popliteal ligament of Winslow, which is shown best here from this posterior view. Note the direct insertion of the semimembranosus onto the posterior medial corner of the tibia and the oblique popliteal ligament as it fans out across the posterior capsule. As we return to layer 3 anteriorly, we reflect the VMO and the more superficial structures anteriorly to reveal the thin capsule between the patella and medial epicondyle, which is layer 3. Distally, the deep MCL, also a part of layer 3, is sharply dissected to show its intimate capsular relationship and its attachment to the medial meniscus. Just distal to the joint line, sharp dissection is again carried out through the coronary ligaments or meniscotibial ligaments, which further serve as a stabilizer of the medial meniscus. Before moving to the lateral side of the knee, let us briefly summarize the dynamic complex known as the posteromedial corner. The meniscocapsular structures of the posteromedial corner work in a coordinated fashion as a primary restraint to anteromedial rotary instability of the tibia on the femur. The key stabilizing components of the posteromedial corner include the posterior horn of the medial meniscus, the posterior oblique portion of the superficial MCL, the semimembranosus with its 5 insertions, and the meniscotibial ligaments.